Welcome to Second Saturday. I'm your host, Professor Alfonso Siverls. Joining me at the table is a former student of mine, Damian Reed. Mr. Reed, welcome to the show.
Thank you so much. Thank you for having me.
Well, we haven't had a chance to talk in a very long time. I believe the last time I saw you was in 2008 when you graduated from Hostos Community College. Is that correct?
Yes, that's correct. That's a long time ago. Roughly going to 9 years, right?
Right. You were one of the few male students who came in and knew, I want to go in nursing. And
Right.
you did that.
Right.
You did that. Where did that come from?
Well,
I mean, you were a young man, and you decided nursing was the profession for me.
yeah. Well, I don't want to tell you that I always wanted to do nurse all my life, because that wouldn't be true. I'm originally from Jamaica. I immigrated here, I think in 2004. It gave me a new start. I was looking for, to jump on a career. My aunt, who has been a nurse forever, and she was successful. And she told me, look towards nursing. You should think about doing nursing. And I'm like, nursing, really? But I knew, based on my aunt's success and what she did, I researched it, and I was surprised, how much you could do in nursing.
Right.
You don't have to stop at the bedside. There's a tremendous opportunity to do so much. And I'm like, wow, this is a great career.
And the pay's not bad.
No,
right?
it's not. No, it's not. It's very competitive salary out there.
Right.
I remember my first job in 2008. I had an associate degree, and I was paid annually $75,000. That was my first.
Wow.
So not many career gives you as an associate
2-year degree.
Yeah.
That kind of salary.
No, it doesn't.
So competitive to get into nursing programs, as you very well know.
Yeah, it is. It is. Yeah. I think one of the issue is there's not much space, and
Sure.
faculty issue. I mean, not much. People are coming in to teach in nursing.
Yeah.
I think it's the returns in terms of teaching nursing. There's more returns in working in the
Make
hospital
much more
settings.
money working in the hospital. So
Yeah.
you got your associate's degree,
Yes.
and then you went to work in the hospital, and you went on to get your bachelor's and your master's. Was that paid for by the hospital?
Yeah, I was very fortunate to be a part of an institution that, really pushes your nurses to go on educationally. And as soon as I started, I was, you're able to start a program and
Right.
go on. You could do your bachelor, you could do your master. They pay up to PhD level, which they'll definitely pay for all of but you're bonded to the institution, which of
Right.
course, is the give back. But that's an amazing opportunity, definitely.
So now you are a nurse practitioner, am I correct?
Yes, you're definitely correct.
And tell me a little bit about that. What does that entail?
Right. So I just finished my master's degree last May. Graduated from New York University as a nurse practitioner, and I'm looking forward to transition because I'm currently working as a registered nurse, a staff nurse, inpatiently on a unit inside the hospital. So I'm about to transition into a nurse practitioner role, which I'm very excited about. But in terms of nurse practitioners right now is in very high demand, definitely. Especially within in the ACA, Obamacare, which I don't know how long that's going to stay for
Right.
based on what's going on. But, it pushed preventative care.
Sure.
And a lot of nurse practitioners are educated in that realm in prevention, in primary care, because what happens is that there's not much return in preventive care for
Exactly.
physicians, so there's a shortfall. Most physicians want to go into specialty care.
Yeah. Make more money. Yes.
Exactly, where the dollars are.
Makes sense.
Right. And so, nurse practitioners are really the remedy for that, because, we're easier to produce, and, the research shows that we're a value for the money. We actually do great health outcomes when we're taking care of patients.
If you can do preventive services and intervention with diabetes and high blood pressure,
Right.
and cardiovascular disease, this will save quite a bit of money.
Of course, that's exactly where we should be putting all the resources. But this whole um, medical field is upside down. We're always the most of the money is put into acute care when the problems occur, and not before the problem.
Right.
Yeah.
So the ratio of female nurses to male nurses, well, at least in New York, we know that you have much more female nurses than male nurses.
Yeah.
I read where California, the ratio of male nurses to female nurses is that for every 5 nurses, 1 is a male.
Right.
Now here's the really tricky one. I read that Nebraska
Right.
is the opposite. For every 5 male nurses, you have 1 female nurses. So you have more male nurses in the state of Nebraska than you have female. Why don't we have more male nurses in New York City?
Yeah, that's a big problem, and I think if you really look at the statistics all around, it's nationally.
Okay. All right.
The last U.S. Census Bureau, they put out some stats, and I believe it was looking at male nurses. The whole workforce of nurses across the nation is 3.5 million, and of that number, it's only 9.6% that was male in 2011. I mean, in the 1970s it was like 2.6.
Right,
So we're,
right.
it has grown. It's about 200% since then between 1970s and now. But I think one of the major problems preventing male, I don't want to say male nurse because that's even the wrong terminology. But just for argument's sake, the problem preventing males from coming into nursing is that I think it's been stereotyped as women's work.
Yes.
A lot of male doesn't think about nursing as a career.
Absolutely.
And I think it happens. I should give you a story. When my son, my older son, he's 8 now, and when he was about 5 or 6, he was asking, myself and his mom what we do, and I say I'm a nurse, and his mom who's also a nurse and who's also, and she's transitioning to be a medical doctor, and we told him that. And he was like, no, daddy's the one that's supposed to be the doctor. And mommy's a nurse. So they're getting, they're getting from
gender stereotypes from such a young age.
Yeah,
And
definitely.
it's such a diverse profession. So many areas you can go in.
Oh, yeah, absolutely. I agree with that. Nursing has tremendous growth for, career opportunities. Myself, I've worked in the orthopedic unit, taking care of orthopedic patients, pre-surgery, post-surgery, the knee replacements, the discectomy, back, all the bones issues that comes on with orthopedic. And I've worked there for 8 years. Now that I've did my master's degree, I'm a nurse practitioner. I've known some of the surgeons, and actually one of the surgeons who had an opportunity in his office. He does sarcomas, bone sarcomas, which is a specialized part of orthopedics. And then he actually offered me a position to basically run his practice. Manage his practice outpatiently. Right. So that's a tremendous opportunity for myself. Sure. So wherever you go into nursing, there's always tremendous opportunity for growth and for upward movement.
Especially the fact that people are living so much longer.
Oh yeah.
The demand is from what I read, the demand is just skyrocketing for nurses.
Yeah, and you touch a big issue right there. The population is getting older.
Sure.
It is. People over 65 will be doubling in 2060. Right now we have 46 million roughly of older people over 65. And imagine in 2060 it'll be double that number with all the chronic conditions that comes along with the old age in terms of diabetes, hypertension, arthritis. You definitely need nurses.
We don't have the supply to meet that demand.
We don't, and that's why reaching out to males.
Yeah.
Reaching out to males. I read a report, and I think it came out in 2010, the Institute of Medicine, it was about the future of nursing. And he spoke about we need to diversify the workforce. I mean, and, we see what, like, ethnicity have done, because in terms of, like, the care need to be patient-centered.
Exactly.
So, in terms of ethnicity has its we have done really good in terms of offering people cultural appropriate care when we give people diversified care. So we should do the same thing with gender.
Yeah.
Yeah.
Yeah. As you know, I've been teaching college part-time, oh, 38 years, something like that. Well, at least I can talk in terms of the last 10 to 15 years, because that's about as far back as my memory will go. I don't think I've ever had a Latino student who was going into nursing male. And I can count maybe 2 to 3 black student males
Right.
going into nursing.
Right.
They just don't even consider it.
Yeah.
And it's, as you say, it's diverse, tremendous opportunity, excellent salary. And I don't think it's the science that necessarily scares them away. I don't think they even consider it. Maybe the stereotype thing is stronger than what.
Yeah, I truly believe that the stereotype is one of the major factors. And, I think hospital needs to start to, come together with community services, come together with local schools, from the elementary level, and, get it into our children, that, listen, this is a career path that you could take. Because a lot of males, I don't think they're even consider nursing as a career.
Exactly.
It's not an option.
Sure.
And I don't know. There was a saying that males are not. Nursing is supposed to be nurturing and compassionate. But yeah, we male nurses are gentlemen. And and I've never go into a room where a patient said, "Oh, you're male, get out." Never. I mean, they love to have me when I walk into the rooms. And there's nothing that, if you're not going to do anything personal to a patient. You work with a lot of females, so you're going to get help to do anything that's too personal.
Right.
So. I think there's more advantages in being a nurse than not being a nurse.
And when you're sick, you don't really care too much about gender, race, ethnicity, or religion.
No.
If someone's there to help, you're appreciative of that help.
Exactly.
You ever had any regrets about choosing this profession?
No, I haven't. I have not.
You said that without a doubt.
Without a doubt. I mean, it has given me tremendous opportunity to do so much. I go home every day. When I look in the mirror, I'm happy for the day's work I've done. It gives me opportunity to help somebody, and that's a reward you get from nursing.
Absolutely.
Just to be able to hold someone's hand.
Sure.
Sit down, talk to them, listen to them, because when someone's sick, they're in a delicate position. And it's a very difficult position, and for you to be there for that patient, because the nursing model looks at the patient holistically, and that's the difference between the medical model.
Exactly. With medical, you sort of deal with symptoms.
Yeah, you do. Yeah. So we look at the patient, the whole patient.
Sure.
And we try to make the patient better from a holistic perspective.
Good. How did you end up in orthopedics? Was that just a fluke or choice?
Right. No, it was just the availability.
Okay.
Yeah. So that was a position that was available when I applied. And so it just happened, and I was in the orthopedics. You have the opportunity to move to different floors. Once you get involved. A lot of nurses want to take on. It's nurses who like adrenaline junkies. They probably want to go to critical care, the emergency room, where they're jumping and hopping. A lot of things. But me, I like to pace myself. I like to have time to sit down with my patient if I can have a conversation. When you're busy, it doesn't always happen.
Right.
But that's my liking. I see patients. As I said, pre-surgery and post-surgery. And, I try to help them through that transition, be the coordinator of care on the floor, make sure everything is in place for them to go to surgery, getting them ready for all these diagnostics. So many things are happening when the patient comes on the floor.
Right.
And,
And I assume every patient is unique in themselves.
Yes,
And how
yes.
they're dealing with whatever their illness or
Yes.
sickness may be.
Yes. And that's what makes nursing exciting. Because
Yeah.
every day you go and every room you go into, it's a different opportunity to experience something different with somebody else. Because, they're all different
Sure.
personalities.
Sure.
It doesn't become mundane, it's
Never boring.
no.
Huh? Never boring. And
No.
a constant supply of people with the need for your help.
Yes, yes, yes. Yeah, they wouldn't be in the hospital if they didn't need help.
Sure,
And,
sure.
and once you're a nurse, you understand that, and you try to help as much as you can with all the challenges.
Now, you said your wife's a nurse?
Yeah, she's a nurse actually. Yeah, good story. She was actually a nurse in my associate degree program at Hostos, and that's where we
Okay.
met.
Oh, okay.
Yeah.
And is she at the same hospital or?
Yeah, well, we work for the same company, but
Okay.
my institution has several hospitals spread across Bronx and the Upper Westchester. So she works at a different campus.
Yeah.
But yeah, we were lucky enough to become a part of the hospital of the company that we're working for now.
And you also said that she is interested in becoming a medical doctor?
Yeah, that was her first love. She's also an immigrant from Niger, and she came here. I mean, she was always interested in medicine back home, but she came here and she did nursing, and and she wants to go back in terms of the medical field. So she already completed her pre-med. Looking forward to take her MCAT very shortly.
Wow.
Yeah.
Is that fairly common with nurses going on to a MD program, or not that common?
I don't think I don't think it's that common. No, I wouldn't say so. It's probably more rare than
Right.
yeah. Because I think, I mean, for me, getting in nursing and becoming a registered nurse, the trajectory for me was, to go on and become a nurse practitioner and just continue in nursing. Because, the medical route and nursing route is completely two
Really
different routes.
different,
You
right.
have to start over. So, I commend her. She's brave to
wanna do that.
Yeah, I want to do that. Yeah.
Now that nursing spectrum, I mean, you have the LPN, which is basically a certificate program. They still have those programs.
Yes, they do.
That's
They
a
do.
licensed practical nurse. That's about a year.
Yeah, that's roughly a year. So I mean, a lot of these programs I think was born out of the nurses shortage that we
Yes,
had.
yes.
The associate degree program too,
Right.
and because they wanted to produce nurses quickly. For the because they were being overwhelmed with so many patients, especially in military exercises and historically, probably World War II or so. So the
Right.
associate programs grew out of those conditions.
Right.
Yeah, and LPN that the registered nurse would supervise an LPN. There are certain things like in the hospital, you won't find that much LPNs in an inpatient hospital setting. You'll probably find them mostly in the nursing homes.
Right, with seniors.
Yeah,
yes.
yeah, with seniors and
And
but-
then you have LPNs, you got your RNs with associates, then you have your RNs with bachelor's degrees.
Right.
A lot of the hospitals are requiring RNs to have bachelor's degrees these days.
Yes, that's definitely very true.
Then you can go on in nursing to get a master's degree. And probably what most people don't realize is that you can get a PhD in nursing.
Oh yeah, absolutely. And there's an even more exciting degree again. There's a DNP, where there's a doctorate of nurse practice.
I never heard of that. Really?
Yeah. So I mean, the PhD degree is more geared towards
Academics, yeah.
So, myself, I'm a master's prepared nurse practitioner.
Right.
But I mean, so there's a push for NPs to be doctorate prepared, to sit at the table with everybody. Because if you think about all the other professions,
Sure,
everybody is a doctor.
Yeah,
Doctor
we're
of
very
pharmacy, doctor of
title-orientated
medicine.
in this country,
Yeah.
especially in medicine.
Yeah. So, to just kind of like, give equality at the table, there's definitely a push for entry-level MPs to have their doctorate. You're practicing MPs, but so that's where the doctor of nurse practice comes in. I think probably in the future,
Might consider.
yeah, yeah, definitely.
You need a break right
Yeah,
now.
no, yeah, absolutely.
Wow. Wow. That's it's an amazing field. And have you ran into stereotypes in terms of being a male nurse? Or in other words, people making comments or reacting to the fact that the nurse, in your case, you being male?
Yeah, every now and again you get it. You walk in the room, people think you're a doctor. I get that a lot. It's like, or they'll ask you, when are you planning to become a doctor? It's quite a frequent question you get, as if, males,
Should, yeah.
So, I don't think I have I've found the correct answer for that yet. But, I tend to tell them, this is my career. This is what I want to do, nursing. I'm not planning to become a doctor.
Good.
Yeah.
And you made that choice pretty early in your life. You can thank your aunt for that.
Oh yeah, I'm glad she pushed me to look into nursing.
How was the experience at NYU?
It was very good. Yeah, I had very good feedback from the faculty. And they have amazing faculty at
It's a
NYU.
well-respected program.
Absolutely, they're ranked between number 1 and 2 every year. They're geriatric because they're big in terms of geriatric nursing.
Sure.
Because they're definitely following the research and what's happening.
Sure.
And so their geriatric nurse practitioner program is ranked number 1 or 2. And the last time I believe it was number 2 in the nation.
Any field in geriatrics is the field of the future.
Yeah, absolutely.
Because people are living longer.
Yes.
I was speaking about nurses and shortage. I was reading that there is a pretty significant percentage of current nurses who will be retiring in the next 10 to 15 years, and they project that that's going to add to the shortage even more.
Right. Yeah. The turnover rate in nursing it's quite substantial. Nurses who are retiring, some, nurses who are, get burned out sometimes, probably not a career for them. And, so, there's a lot of projection that there's going to be, a shortage in the very near future,
Sure.
coupled with the fact that of the, the geriatric boom.
Right.
So, we really need nurses, and we need more people to get into nursing.
Right.
And the last time I looked at the stats, it was 9.6% of males that was involved in nursing. So we absolutely need that number to raise.
I remember in the 1970s that they actually recruited nurses from the Philippines.
Yeah. I don't know if there's a lot of that still going on now,
Yeah.
but I know before there was a lot of recruitment initially, to fill the void. I think they had catch up to a bit, so probably the recruitment drive slowed down a bit. But now the projections are saying there's going to be shortfalls again. I think we definitely need to do more and get the males involved.
Exactly.
Yeah.
And there's a great thing about this profession. You can almost design your work. Like when you want to work, you were telling me you work 12-hour shifts, 3 days, and you have 4 days off.
Yeah, so you don't have to always be doing the 9 to 5.
Right.
If you want to do the 9 to 5, there's nursing positions for that. You could work in the clinics outpatiently; those are generally 9 to 5 hours. But if you work inpatiently, myself, I work three 12 hours.
Right.
A week. So I have 4 days off a week. I have an amazing amount of time for my family and recreation.
Right.
And a nice balance with work-life balance.
When I was a few years ago, unfortunately I was in Beth Israel, and I like to talk to the nurses and the staff. And this one nurse was explaining to me that she's a traveling nurse, and she has a good friend who lives in San Francisco, and her friend is a traveling nurse. So she works in New York City for 6 months. She has an apartment, and a friend works for 6 months, and then they switch.
Yeah.
What a great
Yeah.
life.
Yeah, that's another one of the great things about nursing that you can do. Traveling nurses are really good for someone who wants to move around, change the scenery every now and
Right,
again.
right.
That's another thing you could do again.
Damien, this has been really informative,
Yes.
and it's great seeing you again.
It was a pleasure.
And
It was a
thank you
pleasure.
so much for coming to the show.
Thank you. Thank you for having
I
me.
hope you guys enjoyed today's show. And if you are a young person, or you don't even have to be that young, if you're considering and looking for a career, nursing, especially if you're male, the demand is there, the salary is good. Why not? And okay, I will see you again on the next second Saturday.